Good evening, everyone, and welcome to today's wonderful discussion. I hope you all downloaded the Incus learning app, took the daily grand test of 100 MCQs. If you have done that, this discussion looks normal speed. If you have not done that also, no problem. Better late than never in the game of love and war. So you will be knowing at least what are the questions in the grand test today, what topics you are really good and where you need to improve. That is required every day for the next 40 days. Please invite your classmates, roommates, benchmates, WhatsApp mates. Please drop a line in Telegram and WhatsApp groups that the live class has started. So let us make the great beginning, Doctor. Yes. Good to see Abharanam and many more who are all online. Great. So, Doctor, we are supposed to start at 6 o'clock, but today I got a little late. Sorry for that. But once more, better late than never, whether it is war, love, or NEET PG preparation. So let's make the great beginning and crack the 100 questions of the day. Keep punching your answers, Doctor, parallelly, so that what happens is you will be proactively participating. Cerebellar myelination in a newborn is completed by 1 month. Purely batti marne wala item hai. Root of mesentery is crossed by what are all the structures? So you should know the third part of the duodenum, not the second part, not the second part. Third part of the duodenum, abdominal aorta, inferior vena cava, right ureter and right psoas cross the root of mesentery. Pocket miracle. Definitely आने वाला क्वेश्चन है. Now I want to ask you a quick quiz question. Which visceral artery most frequently affected by aneurysm? Come on, who is going to give me the answer? Punch your answer, doctor. This question is for a bet with all of you. Punch your answer. Which visceral artery? Make it an interactive session. Punch your answer into the chat window. Which visceral artery is most frequently affected by, into the chat window. Which visceral artery is most frequently affected by aneurysm? This is one of the favorite MCQ sure shot आने वाला क्वेश्चन है कल के नीट पीजी एग्जाम में. Splenic artery is what you need to remember. Superficial branch of the ulnar nerve. What does it supply? It supplies palmaris brevis, is what you should remember. So, if you look at the various muscular branches of the ulnar nerve, flexor carpi ulnaris, flexor digitorum profundus medial half, and in the hand, with the deep branch of the ulnar nerve, it will be supplying hypothenar muscles, opponens digiti minimi, abductor digiti minimi, flexor digiti minimi. Third and fourth lumbricals are also supplied by the deep branch of the ulnar nerve, is what you should remember. Deep branch of the ulnar nerve. Then all interossei, dorsal and palmar interossei. Interossei are tested by CART test. Then there is one thenar muscle. Most of the hypothenar muscles are all by the ulnar nerve. There is one thenar muscle which is supplied by the ulnar nerve. That is adductor pollicis. And you use the book test to test the adductor pollicis. Then flexor pollicis brevis, deep head, is also supplied by the deep branch of the ulnar nerve. So this list you have to remember, doctor. Invariably, कल के नीट पीजी एग्जाम में पूछेगा. In the hand, the superficial branch of the ulnar nerve supplies palmaris brevis. Then what is the sensory supply by the ulnar nerve, doctor? Fifth digit and the medial half of the fourth digit. That is what is being supplied. So I leave all this literature for you in the Incus learning app. So every day, all these 40 days, 40 full-scale NEET PG mock tests are being provided as a package. In the morning, there is a test that you play on the Incus quiz app. And evening, 6 p.m., we have a discussion of all the 100 questions. So that's how every day you should practice until the NEET PG exam. You need to pick up every day. For example, today now we discussed extensively about ulnar nerve. So ulnar nerve, radial nerve, medial nerve, musculocutaneous nerve, axillary nerve, the brachial plexus and the injuries, and how do you test these nerves? Definitely a question aane wala hai. You have to be 100% sure about. Now, what is the sensory supply to the skin on the dorsum of the hand and digits? Which nerve, doctor? Radial nerve is what you should remember. Now, closing of the jaw, opening of the jaw. If you go to the NEET PG exam, jaw, opening, closing, sure short MCQ. Please remember. Whenever I say sure short MCQ in NEET PG, you know very well, paper is out. I'm leaking you the paper. So you should be very sure to remember it. Dil mein laga ke, kyunki if you look at the previous AIMS, PGI, JIPMEN, All India, all these exam question bank, DNB, FMG question bank, every time they keep asking the same question. Closing of the jaw, opening of the jaw. What are the muscles involved? That's the reason you have to be 100% sure. Exam hall mein kuch guess marunga, मुझे आंसर बताएगा, कुछ भी नहीं होता. If you don't know, you don't know, that's all. So inferior head of the lateral pterygoid, anterior digastric, mylohyoid, they make the opening of the jaw, closing of the jaw. Masseter, anterior and middle temporalis, medial pterygoid, superior head of the lateral pterygoid. And protrusion of the jaw is the bilateral contraction of the lateral pterygoid. Retrusion of the jaw, if you are retracting the jaw, it is the middle and posterior temporalis helped by the deep posterior part of the masseter. Then laterotrusion, side by side, is the ipsilateral middle and posterior temporalis and contralateral inferior head of the lateral pterygoid. Together lead to laterotrusion is what you need to remember. So which is that muscle, doctor? Come on, punch your answer. बीच में हम जरा quiz questions बोलेंगे and you have to punch the answers. Which is that muscle that depresses, protrudes the mandible, and unilateral contraction will move the jaw in a grinding fashion? Come on, punch your answer, doctor. कल के नीट पीजी एग्जाम में जॉ का मसल्स का क्वेश्चन जब आते ना, मुरली भरद्वाज आपको याद आएगा एग्जाम हॉल में. So it is the lateral pterygoid is what you need to remember. What is the hardest substance in the teeth, doctor? Dentin. Simple diffusion जहां होता है, दहेज नहीं होता, no dowry. ATP will not be involved in simple marriage, simple diffusion. But the size of the molecule, lipid solubility, number of channels, they all will decide the simple diffusion. What increases the GFR? What decreases the GFR? You should know very well. So the factors affecting the GFR. Any increase of renal blood flow will promote filtration. Similarly, capillary hydrostatic pressure is a determining factor. And any change in systemic blood pressure will increase. Increased BP will increase the GFR. Similarly, afferent or efferent arterial constriction is a deciding factor. Similarly, change in the concentration of plasma proteins like dehydration, hypoproteinemia, they do affect the GFR. Effective renal plasma flow. What is the substance you use to calculate that, doctor? MAG3. Technetium 99M label, mercapto, acetyl, triglycine is the substance. MAG is the one which is used for effective renal plasma flow is what you should remember. So why after exercise neutrophil increase? Because that lead to demargination. That will make the neutrophil to delodge. So demargination will increase the neutrophil after the exercise. Myelination. What is the advantage of myelination? It is a protective covering. It allows faster conduction. It will decrease the energy expenditure from the neuron. Neurons are continuously involved in transport of the electrical signals. For that, myelinated energy, less amount of energy is required because it is the saltatory conduction from one node of Renwire to another node of Renwire. So because it keeps jumping like this, Superman, Superman, Spider-Man, Spider-Man, like that it will keep jumping from node of Ranvier to node of Ranvier. If it is a myelinated neuron, that's the reason less amount of energy is really required. Now, doctor, oxygen dissociation curve, shift to the right, shift to the left, shift to the right, shift to the left. You have to be 100% sure on the factors. Once more, Liklo, sure short MCQ, which is going to come in the tomorrow's NEET PG, and FMG. You have to be very sure. Sure short है. अगर ये मालूम नहीं है एग्जाम हॉल में, अगर आप मासूम चेहरा लगाए तो इस साल के लिए आप you lose the game. You should not lose the game. So doctor, remember, oxygen dissociation curve. Typically, whenever carbon dioxide levels increase, acidosis increase to 3 dBg, increased temperature. They are the time where hemoglobin should release oxygen. How will that happen? If the affinity of the oxygen decrease. So that is called shift to right. And increased affinity. मैं नहीं देता हूँ, ऑक्सीजन मेरा है बोल के पकड़ के रखेगा. कब? If there is a fetal hemoglobin or alkalosis or decreased to 3 dBg, decreased temperature, there's an increased affinity of oxygen, which is called left shift is what you need to basically remember. For the gout, it is the PRPP synthase. Gout is because of too much of uric acid. So what are involved in uric acid synthesis? Glucose 6-phosphatase, then 5-phosphoribosyl aminotransferase and PRPP synthase. They're all involved. Not the xanthine oxidase. We inhibit the xanthine oxidase using the allopurinol. We inhibit the xanthine oxidase so that we decrease the uric acid production. So xanthine oxidase deficiency will not lead to the gout. It is the PRPP synthase, glucose 6-phosphatase, 5-phosphoribosyl aminotransferase. Their deficiency will lead to the development of the hyperuricemia, is what you need to basically remember. Now, there are so many steps in urea cycle. Once more, doctor, take it as my word. यूरिया साइकिल के ऊपर अगर क्वेश्चन नहीं है तो कल के नीट पीजी में मैं त्याग पत्र दे देता हूं टू बी ए टीचर. उतना खास टॉपिक है, लिख लो, शूर शॉर्ट एमसीक्यू. सो ऑलवेज डॉक्टर, taking a entrance exam, NEET PG exam, there's nothing surprise about it. If you are an unprepared student, you are surprised. But you are like what? You are like an army, Indian army, right? You know how to use AK-47. Like that, you are a strong guy. So you have to bomb the examiner. You should not be surprised. You expect a urea cycle question. You will expect a galactose metabolism question. You will expect a porphyria question. सब कुछ एक्सपेक्ट करके जाना है कल के एग्जाम के लिए. That is the whole purpose of coaching, bleaching or anything, right? So, sure short लिख लो, urea cycle. So, which step of the urea cycle consumes ADP, doctor? Arginosuccinate synthesis. So, और एक बार मेरे साथ फटाफट रिविजन करो. Ornithine बनेगा citrulline. Ornithine transcarbamylase, where carbamyl phosphate provides the phosphate. So ये सब mitochondria में होता है. Citrulline enters into the cytosol, and citrulline consumes an aspartate to form arginosuccinate. इस शादी होने के लिए एक ATP का consumption होगा. There will be one consumption of 1 ATP for this marriage. Arginosuccinate become fumarate, fumarate become L-arginine, L-arginine become ornithine, ornithine once more enters into mitochondria. Punarapi maranam, punarapi jananam. That's how urea cycle. So common MCQ asked in entrance is, what enzymes are in mitochondria? What enzymes are there in cytosol? So, doctor, ornithine transcarbamylase and carbamyl phosphate synthase. Carbamyl phosphate synthase कैसे कार्बोमाइल फॉस्फेट का तैयारी करेगा. Carbon dioxide plus ammonia will give you carbamyl phosphate is what you need to emphatically remember. Now, corticosteroid, what is the effect of it? It increases the lipolysis. It causes protein breakdown and amino acid mobilization. It increases the glucose formation. That's the reason to the patients to whom you give steroid, they will end up in hyperglycemia and glucose intolerance. Right? So that's the point. Now, after fasting 24 hours, once more remember, fasting, feeding, starvation, and overfeeding. This is a favorite MCQ. What are the biochemical changes? Which enzymes levels will fall down? Which enzyme level will increase? Definitely पूछेगा examiner. Now, after fasting for 24 hours, what do you expect? You expect gluconeogenesis, lipolysis, glycogen breakdown. They're all the things that happen. Once more, doctor. Secondary messengers. Secondary messenger. Sure shot आने वाला टॉपिक है कल के नीट पीजी के लिए. Sure shot MCQ. Okay. Secondary messengers. So there are totally 950 high-yield topics, doctor, like this, from which your 200 MCQs in the tomorrow's NEET PG are going to come. 950 को पढ़ने के लिए आपको कितना देर लगता है, डॉक्टर? Not more than 400 to 500 hours. Do we have that much time? We have, because still we have 40 more days before exam. So where do we find these 950 high-yield topics? Incus app download karo. Download Incus app. In the courses, you have 2000 HD videos for the NEET PG exam. In that, you have all these 950 topics. Today only, download the app and do the revision. So nitrous oxide, brain natriuretic peptide, atrial natriuretic peptide, they all use the cyclic GMP is what you should remember. Coming to culture media. LJ medium, Lowenstein-Johnson medium for TB bacilli. Blood agar supports fastidious organisms. Lochless serum slope for Corynebacterium diphtheria. भैया, anaerobic culture media क्या होता है? Robertson cooked meat medium, thioglycolate broth, Smith-Noguchi medium. They're all anaerobic culture media. Once more, culture media, different culture media. इसके बारे में there will be about 20 to 30 points that you have to smug. So, if you know what examiner is going to ask, and if you know where you are really weak among the examiner's expected topics, that's all. Where the 2 points meet, you become the winner. So that is the reason every day आप 100 MCQ का मॉक टेस्ट ले लो इंकस क्विज ऐप में. शाम डिस्कशन अटेंड करो. 10 to 20 टॉपिक्स पकड़ लो. फिर जाके 2000 HD वीडियोस जो है इंकस ऐप में रिवीजन करो. नेक्स्ट 40 days we will be discussing 4000 MCQs. शूट शॉट आने वाला MCQs for the NEET PG examiner. बस अगर सीट आपको नहीं आए तो टॉप रैंक मेरा जिम्मेदारी. Right? Now, doctor, E. coli produce a green metallic sheen on which culture medium? Eosin methylene blue. So you should remember eosin So you should remember eosin methylene blue. It is a selective medium, it is a differential medium. It is the enteric gram-negative rods which are grown and identified, and E. coli will give green metallic sheen is what you should basically remember. Green metallic sheen. Now, the next favorite question of the examiner, MHC class 1 and class 2. You have to be very sure on. MHC class 2 is present on dendritic cell. So HLA class 1 antigens are A, B, C. They are found virtually on all nucleated cells. Class 1 molecule also function as a component of hormone receptors. Then class 2, they are more restricted, they are only present on APCs, antigen presenting cells, like macrophages, dendritic cells, B cells, and activated T cells. T cells normally do not possess MHC2. Only when they become activated T cells, then they will express the MHC2 molecule is what you should remember. Now, with regard to the NK cells, interferons augment the NK cell activity. And NK cells are the initial cells to step in whenever there is a viral infection. Even tumor surveillance is also managed by NK cells. And NK cells are not restricted by MHC. That is important. Not restricted by MHC. And they mediate what is called ADCC, antibody dependent cell mediated cytotoxicity, is mediated by the NK cells, is what you should basically remember. And what are the two CD markers you should not forget on the NK cells, doctor? CD16, CD56. They are the two important surface markers on the natural killer cells. Now, northern blot technique. So, southern blot, DNA. Northern blot, RNA. Western blot, protein. You should be very sure. Now, my quick question to you, once more to tell you how important is the most important topic. After this mock test discussion is over, immediately you should go back and do the revision of culture medium. So there are about 30 HD videos of 20-minute duration that completely revise microbiology on the Incus app under 2000 HD video NEET PG video program. Okay, so you need to go back and do the revision after this discussion is over, right? So remember, doctor, SMAC, Bordered Gengu, BCYE. Let's quickly mince few points about each of them. SMAC, sorbitol mechanki agar. It selects all E. coli O157H7 and it differentiates sorbitol fermenters. Then Bordered Gengu, it is an enriched medium. It is a Bordered Gengu is a enriched medium. It is selective for Bordetella pertussis. And it is also called charcoal horse blood agar, Regan Lowy. BCYE, ये क्या होता है? Buffered charcoal yeast extract. It is also enriched medium and selective for Legionella. Culture media. आज के फुल स्केल ग्रैंड टेस्ट में व्हाट इज द टॉपिक यू पिक्ड अप? मैं आज जरूर पढ़ना है culture media. Sure short topic for tomorrow's NEET PG exam. Okay. Now, MRSA, methicillin resistant staphylococcus aureus. We use pulsed gel field electrophoresis for typing. So, what is the gene which is there in MRSA, doctor? MEK-A gene. MEK-A gene. This MEK-A gene encodes for the penicillin binding protein 2A. And cephalosporins, carbapenems, penicillin, everything MRSA is resistant. So for life-threatening MRSA infections, vancomycin is the drug of choice. And next, aerogenic Shigella. Shigella flexneri type 6 is aerogenic Shigella. So, Shigella species which ferment glucose with the production of the gas are aerogenic Shigella. So, the Shigella which know how to fart are all aerogenic Shigella. So, examiner's question is, which are those farting type of Shigella? Shigella flexneri type 6. ये तो बकवास MCQ है, बट फिर भी आप याद रखो 200 MCQs of the NEET PG में डेफिनेटली एक 20 to 30 क्वेश्चंस एकदम बिल्कुल बकवास क्वेश्चंस will be there, but you won't be surprised. ऐसे बकवास चीजों को don't get tempted to answer in an exam which has a negative marking, right? You should know, examiner मुझे he's pulling my leg, that's the reason he gave this MCQ. बोल के 20-30 questions को छोड़ना भी आना, right? Now, proton pump inhibitor, if you happen to give along with which antiplatelet drug will decrease that antiplatelet activity? Clopidogrel plus proton pump inhibitor, drug interaction you should know. There is a small reduction in the inhibitory effects of the clopidogrel on the ADP-induced platelet aggregation. Clopidogrel normally inhibits the ADP-induced platelet aggregation. This effect of the clopidogrel will decrease if you combine proton pump inhibitor plus clopidogrel, will decrease the antiplatelet action of the clopidogrel is the drug interaction. Erythromycin, it is a macrolide that inhibits the protein synthesis and it stimulates the GI motility by acting on motilin receptors. And because of that, there is often an epigastric distress if you happen to take the erythromycin tablet. So the same function is used, erythromycin's, this specific function is used post-operatively to promote the peristalsis. We use this function. Both types of diabetes may be used pramelinitide. So once more, doctor, without a question, sure short topic, Liklo, remember it as my word, insulins and oral hypoglycemic agents, especially the newer drugs, newer diabetic drugs, their side effects, their mechanism of action, everything you have to be 100% sure about. Paka, will you promise me? Tonight, will you pick up one more important short topic, having attended this discussion of the NEET PG mock test? Insulin oral hypoglycemic agents. आज ही आप खत्म करना रिवीजन को, गर्मा गर्म रेडी हो जाना, क्योंकि डेफिनेटली आने वाला टॉपिक है. सो वंस मोर, Incus ऐप डाउनलोड करो, 2000 HD वीडियोस, बोल के आपको एक सब्सक्रिप्शन दिखता, सब्सक्राइब कर लो और उसमें फार्माकोलॉजी के अंदर आपको मिलेगा शूट शॉर्ट टॉपिक डायबिटिक ड्रग्स एंड इंसुलिन्स. Pramlintide is an analog of amylin. It is released into the bloodstream by the beta cells of the pancreas along with the insulin. एक बार खाना खाए तो ब्लड ग्लूकोज लेवल चढ़ जाएगा. जब ब्लड ग्लूकोज लेवल चढ़ेगा, then that will cause the release of this amylin. Just like insulin, amylin is completely absent in the people who have type 1 diabetes. So basically, pramlintide is the analog of amylin, is what you need to remember. So it will augment the endogenous amylin. And by causing the amylin release, it will increase the cellular absorption, regulation of the blood glucose, slows the gastric emptying, promote the satiety. How? Typically, it will go and act on the GLP-1 receptors in the hypothalamus where your satiety center is located. It inhibits inappropriate secretion of the glucagon. So, there are all the various effects of the endogenous amylin, and pramlintide is what you need to remember. Ethanol is used in ethylene glycol poisoning. Why? Because ethanol is a competitive inhibitor of alcohol dehydrogenase. Even fomepizole, which is used for the treatment of methanol and ethylene glycol poisoning, fomepizole is also alcohol dehydrogenase inhibitor, is what you need to remember. With regard to cocaine, what is the true statement? The half-life of the plasma, the half-life of the cocaine in plasma is 30 to 90 minutes. It is very short-acting. It will not suppress the stress of surgery, and it causes tachycardia and hypertension. They are all true because it has got a vasoconstricting property. Which drug has a curare-like effect, doctor? Clindamycin. It acts as a neuromuscular blocker. Now, a very interesting quiz question. Keep punching your answers, doctor. Which drugs are capable of treating the Parkinsonism induced by the antipsychotic therapy? Especially antipsychotic therapy. So antipsychotics are all what? Antidopaminergic drugs. All antipsychotics are antidopaminergic drugs. If the dopamine is antagonized, it leads to development of Parkinsonism. So antipsychotic induced Parkinsonism. Typically, how do you treat? It is the anticholinergics, trihexyphenidyl, benzotropine, mesylate, biperidine, procyclidine. They are most effective to treat Parkinsonism induced by antipsychotics, is what you have to basically remember. So once more, doctor, Parkinsonism drugs is the favorite MCQ, sure shot in the tomorrow's NEET PG exam. Take it as my word. Caspases are associated with apoptosis. Once more, if I've done this question wrong, take my word. Sure short MCQ in the tomorrow's NEET PG होता है apoptosis. Sure short MCQ है apoptosis. You have to be 100% sure. So caspases are associated with apoptosis, is what you need to remember. So in apoptosis, activation of several members of the family of the cysteine proteases, which are called caspases. Then one more favorite MCQ of examiner doctor, sure short MCQ once more. Initiator caspase क्या होता है? Caspase 8 and caspase 9. Executioner caspase क्या होता है? Caspase 3 and caspase 6 are executioner caspases is what I want to underscore. Now, chronic renal failure can happen with membranous glomerulonephritis, FSGN, membranoproliferative, but not PSGN. Typically, post-streptococcal glomerulonephritis में proteinuria may persist in about 60%. Renal failure is only seen in 10%. So that is the reason always PSGN is very unlikely to go into chronic renal failure. That's the most important point you should remember. Type 2 Lepra reaction is type 3 hypersensitivity. 2 plus 3 is equal to 5. Type 1 Lepra reaction is a type 4 hypersensitivity. 1 plus 4 is equal to 5. Favorite MCQ. C-Mike on the chromosome 8 is a feature of Burkitt's lymphoma. Acha bhaiya. One more favorite question of the examiner. Leukemia, lymphoma, kahan ho? Sure short MCQ. Definitely आने वाला topic है जनाब. If you have done this question wrong, immediately go back to 2000 HD video program on the Incus app. Download करो और उसमें ल्यूकीमिया लिम्फोमा एक गर्मा गर्म डिस्कशन अवेलेबल है 30 minutes discussion. Today only you do the revision along with the PowerPoint. The notes is all being provided on the Incus app. So Burkitt's lymphoma, the phagocytes have an abundant clear cytoplasm creating a starry sky pattern. Burkitt's lymphoma जो होता है, it originates from a mature B cell. It expresses the surface IgM, CD19, CD20, CD10, BCLR, BCL6. So they are all indicative that it is originating from germinal center B cell origin. Now, most of the other germinal center origin tumors, they express an anti-apoptotic gene BCL2, but Burkitt's lymphoma does not express. That's the point. And all forms of Burkitt's lymphoma, there's a translocation of the C-Mike gene on the chromosome 8 is what you need to remember. Now, what is the maximum storage time of platelets? 5 days at 20 to 24 degrees Celsius. Now, which is called initiator caspase that activates all other caspases. Caspase 9 is the initiator caspase. Don't forget, kal ke exam mein definitely sure short topic is apoptosis. So, doctor, in this 40 full-scale grand tests that we discuss every day for these next 40 days until April 15th, totally 4,000 sure short MCQs का discussion होगा टेस्ट में. इसको फॉलो हो गया तो उस टॉपिक्स को रिवीजन करे तो you are bound to become a winner in the NEET PG exam. Take it as my word. Aortic aneurysm. It involves all the 3 layers, and it is the elderly person with an atherosclerosis is the commonest cause. And saccular aneurysm क्या होता है? Saccular aneurysm, it is a outpouching only from a portion of the wall, not the entire vessel, only a portion. From a portion, you get the saccular aneurysm is what you should remember. पोस्टमार्टम बर्न, एंटीमार्टम बर्न, मरने के पहला, मरने के बाद, which burn it is the favorite question of the examiner. So you should remember a blister with clear fluid. It is the characteristic of you should know that antemortem burns versus postmortem burns. You should know the differences. Line of redness, vesicles and blisters, infection, base of the blister is inflamed, healing with granulation, upper respiratory tract may soak, the smoke will lead to soot, and a vital reaction, increased enzyme reaction, more than 5% carbon monoxide containing hemoglobin. They're all the features of the ante-mortem burns is what you should remember. Which is a grievous injury, doctor? The tooth fracture dislodgement is grievous injury. So you should remember section 320 IPC, section 319 IPC. Once more, doctor, let me once more tell you. Sure short question बोल रहा हूं मैं आपको. Definitely आने वाला topic IPC का sections. Definitely पूछेगा examiner, छोड़ेगा नहीं आपको. So section 320 IPC, emasculation, permanent privation of the sight, hearing, any member of the joint, permanent disfiguration of the head or face. So they're all considered to be under section 320 IPC, grievous injuries. 319 IPC defines hurt. What is hurt? Hurt is a bodily pain caused to any person. Rigor mortis will make you to know what is the time since death. Lacerated wound appears like an incised wound, typically on the bony surfaces like the shin of tibia. Similarly on the scalp, lower jaw, iliac crest, knee, perineum, even on the iliac crest. Typically, it looks like a incised wound. Cavett test is to detect the alcohol in the blood. OVA is beta-oxalyl aminoalanine, which causes neural atheism. Pearl index is used for contraceptive efficacy. Soiling index is for air pollution. ये तो बिस्किट क्वेश्चंस है, फटाफट आंसर कर सकते. Once more, let me tell you, 200 MCQs में डॉक्टर 100 क्वेश्चंस बिस्किट क्वेश्चंस होता है. Easily बिस्किट क्वेश्चंस. बिस्किट डालो खा लो, बिस्किट डालो खा लो, फास्ट हो जाता है. वहां भी अगर आप आइंस्टीन के जैसे सोच रहे हैं इसका जवाब क्या होगा, means we lost the game, right? Now McGill-Payne questionnaire, visual analog scale, face, legs, arms, cry, consolability scale. They're all pain scales. Quicklett is for obesity index. Central tendency, mean, median, mode, talk about central tendency. Once more, doctor, this is one favorite question of the examiner. What is the relation between these three values? अगर मीडियन दिया, मीन दिया, मोड क्या है बोले तो 3 मीडियन minus 2 मीन and mode is equal to mean minus 3 into mean minus median will give you the mode. Aedes aegypti index, it should be less than 1 near the airports. Indian male energy requirement, who is a sedentary one, 2425 kilocalories per day. Once more, doctor, this is another बट्टी मारने वाला item है mug. This is another smug duck. You have to mug this table invariable. Then protein allowances for adults. This another batti item hai. Mug, smug duck. So adult pregnant woman with heavy work is 3,200 kilocalories, 2,850 plus 350. Daily requirement of protein is 1 gram per kg body weight. Assuming NPU is 65 for dietary protein. Iron during pregnancy is 25 milligram per day and during lactation is 21 milligram per day. Be very sure. Eukaryaria Bankurov tea. DEC 6 milligram per kg body weight diethyl carbamazine per day into 12 days. Totally 72 milligrams per kg body weight need to be administered. But yeah, this is sure short topic. Definitely aayega kal ke NEET PG mein. Once more, I tell you the same thing. After this discussion is over, go to the 2000 HD videos of the 950 high yield topics. This subscription on the Incus app. Today only subscribe and do the revision. ESI is a very important topic. So it is 1.75% of wages. So the employer contributes 4.75% of the total wages. Employee is 1.75%. And the state government share of expenditure in the medical care is 1/8 of the total cost. And the ESI contributes 7/8 of the total cost of the medical care. Sickness benefit. It is payable for a maximum period of 91 days in any continuous period of 365 days. The daily rate being about 50% of the average daily wages is being paid. Extended sickness benefit means certain long-term disease के लिए maximum period of 2 years it is extended. Just like you buy an electronic good, एक laptop खरीदे तो extended warranty, regular warranty like that. Enhanced sickness benefit is payable to an insured woman for 14 days for tubectomy and for the male 7 days in vasectomy with full wages. Maximum hours per week under Factories Act 48 hours. Total hours of work in a week including overtime should not exceed 60 hours. That is the point you should appreciate. What is the minimum recommended dose of the free residual chlorine in the water for the routine chlorination, doctor? 0.5 milligram per liter for contact period of 1 hour. Once more, chlorination, dirty topic. Still we have to read. Sure short topic list में add करो. आंगनवाड़ी वर्कर, आशा वर्कर, विलेज हेल्थ गाइड, आंगनवाड़ी वर्कर, आशा वर्कर, विलेज हेल्थ गाइड, all these, उसको कितना पैसे देते, काय को देते, इंसेंटिव कितना देते, वो सब कैलकुलेशंस आपके टिप्स में रहना है कल के NEET PG के लिए. So which is not the work of a Anganwadi worker. So immunization of children, non-formal preschool education, health education, they're all the works of the Anganwadi worker. Postcoital contraceptives, OCPs, RU486, copper T, etc., etc. Obstructive sleep apnea. What is accepted about it? It leads to any hypoxia due to obstructive sleep apnea. Hypoxia lead to pulmonary vasoconstriction, that lead to pulmonary hypertension, and that lead to right ventricular hypertrophy, not the left ventricular hypertrophy. That is what you should remember. So hypoxia, hypercarbia, right ventricular failure, pulmonary hypertension, they're all the features of the obstructive sleep apnea is what you should remember. In the endemic population, what is the most common type of thyroid cancer, doctor? Follicular carcinoma. And radiation-induced thyroid cancers, they're all papillary carcinoma. Favorite question. Gout. The most common joint क्या है? Big toe. big toe, fingernail, toe. First metatarsophalangeal joint of the big toe is characteristically involved, and typically uric acid level is more than 7.5. Negatively birefringent crystals. Wide fixed second hard sound ASD. All of you know very well. This is the favorite question. Iron deficiency anemia from anemia of chronic disease. How do you differentiate? दोनों में microcytosis होता है. That means the mean corpuscular volume less than 70. But how do you differentiate? Ferritin is a differentiator. So you should know iron deficiency anemia. Ferritin is decreased, iron is decreased. Anemia of chronic disease, iron is decreased, but ferritin is increased because ferritin is one of the inflammatory marker. TIBC, total iron binding capacity, is increased in case of iron deficiency anemia, whereas it decreased in anemia of chronic disease. Transferrin saturation is decreased in both soluble transferrin receptor. It is increased in iron deficiency, decreased or normal in anemia of chronic disease is what I want to underscore to all of you. Who discovered X-ray? Roentgen. And radioactivity was discovered by Becquerel. Obstructive, restrictive, difference क्या है? One of the favorite question, doctor. Once more. आपके white pages notebook में लिख लो. Sure short topic for tomorrow's NEET PG is, out of 30 questions, you can easily predict general medicine. Spirometry. Differences between restrictive and obstructive lung disease. You have to be 100% sure. So, in obstructive lung disease, there's a decreased FEV1 and FEV1 by FVC ratio is typically decreased. Residual volume is increased. Because of that, the total lung capacity is increased because you have inflated lungs in case of the obstructive lung disease. So the lung volume will increase, total lung capacity increase, FRC will increase, and residual volume also increase. That is how the obstructive lung disease is what I want to underscore. Once more, doctor. Inheritance patterns. Sure short topic. Today only you have to go back and do the revision. 2000 HD videos on the Incus app. You pick up the topic called inheritance patterns. Tomorrow's NEET PG, they will give you one pedigree chart. Right? So X-linked recessive. Duchenne's muscular dystrophy. Hemophilia, A, G6PD deficiency, diabetes insipidus, CGD, chronic blindness, gluten gamma globulinemia, they're all X-linked recessive. X-linked dominant, vitamin D resistant rickets called hypophosphatemic rickets, and incontinentia pigmenti are X-linked dominant. Normal anion gap is 8 to 10 millimoles per liter. Now, if there is a pleural effusion, lung collapse, consolidation, how do you differentiate patti rehta pneumothorax? On auscultation, percussion, all these outdated methods. Still, for examiner, they are important. At least pulmonologist stethoscope is relevant. Cardiologist ko bhul gaye stethoscope ko long ago. So, doctor, absent breath sound, diminished vocal fremitus, stony dullness, they characterize the pleural effusion. Then decreased vocal resonance and fremitus, pleural fiction drum, etc. Ankylosing spondylitis, HLA-B27. You should know all conditions: Reiter syndrome, reactive arthritis, psoriatic spondylitis, acute anti-uveitis. They're all HLA-B27. Ab bhi aa gaya. Sure short MCQ, doctor. Sure short topic. High yield topic for NEET PG. Brain stem stroke. brain stem stroke syndromes. You should know Weber's, Nagel's, Claude, and Wallenberg, everything you should know. So there is a 20-minute video, Garma Garam discuss करके छोड़ दिया, Incus app में 2000 HD video subscription में. So Weber's syndrome is associated with third cranial nerve palsy. So typically, ipsilateral oculomotor with contralateral hemiparesis. North-Nagel injury to the superior cerebellar peduncle. Ipsilateral oculomotor palsy with contralateral cerebellar ataxia. Benedict syndrome, it is an injury to the red nucleus. So ipsilateral oculomotor palsy with a contralateral tremor, chorea, and ethitosis. That is what you need to remember. So Dr. Weber, Claude, Parinod, Millard, Gubler. 100% you have to be sure. I don't want to go too detailed about this now because बहुत बार discuss किए कल के नीट पीजी में ब्रेन स्टेम सिंड्रोम में एक सिंड्रोम आएगा. You will remember Dr. Murali Bharadwaz. हम 20 साल से देख रहे हैं एंट्रेंस एग्जाम्स को. Almost 2 lakh students like you were sitting in the classrooms, later on attending the video lectures, later on live online broadcast. समय तो बदल गया मगर विषय तो वही रह गया. सेम 950 हाई यील्ड टॉपिक लिस्ट अगर आप मास्टर किए तो आपके मुट्ठी में आ गए तो nobody is going to stop you, right doctor? So for that you don't need years together of preparation. Third year से शुरू करो, second year से क्यों? Second year, third year में किसी से मोहब्बत करो, dance करो, right? Enjoy the wonderful youth. 6 महीने is enough to prepare and become a topper in the NEET PG. Even if you start from zero also, I know how to make you a hero. If you read with focus, 950 topics, more than enough, doctor. Don't bunk the postings in the internship. You know, internship postings are all, that's the only time you get an opportunity to do mistakes. Foley catheter ko le jaake kahan lag rahe ho? Are you putting into urethra? Are you putting into somewhere else? You have the opportunity to do those mistakes when you are still a house surgeon. You have to do all those mistakes. 6 months is enough to become the topper in the entrance exam if you are preparing with focus. Right, doc? Von Willebrand disease. So basically, von Willebrand factor is required for 2 things. One is for platelets function. Second is also for stability of factor 8. That is the reason whenever von Willebrand disease is there, platelets become dysfunctional, bleeding time increases, even factor 8 become dysfunctional. That's the reason clotting time also increase. So both will increase in von Willebrand's disease. Second point, if you take hemophilia, it is X-linked. That's the reason only boys get affected most of the times. A boy presenting with bleeding means think of hemophilia. But a girl presenting with a relentless menstrual bleeding, menorrhagia, girl bole to it is not X-linked. It is more likely to be autosomal recessive. That's what is von Willebrand is what you should remember. So decrease clotting factor 8, increase in bleeding time, and a defective platelet adhesion. The skin is warm, the skin is dry. What type of shock it is? Neurogenic shock. For the hepatitis B, we use the polymerase chain reaction for screening. Total body electron beam therapy, mycosis fungoides. It is a local skin electron beam irradiation, which is the one which is being used. If Mycosis fungitis is very advanced. Then we use topical glucocorticoids, topical nitrogen mustard, phototherapy, PUVA, Sorolin with ultraviolet A, blah, blah, blah. All these are used. Abhi aa gaya, interesting topic. According to the Sigmund Freud, super ego, when will it develop, doctor? By 5th year of age. So there are three elements in a personality. Id, ego, and superego. Superego, it works together to create complex human behavior. And the id is the one which is the only component of the personality that is present from birth. And ego is that component of personality responsible for dealing with reality. So the ego works based on the reality principle, which try to satisfy its desires. Idu bolta hai, karo, chumma de do. You know Amitabh Bachchan song? De do chumma, chumma de do. Right? So chumma de do bolega kaun? Id. But it is the ego which operates on reality. Are kisko main chumma dene ka try kar raha hu? Is it socially appropriate, inappropriate? It is the one which will check. And the last component of the personality to develop is superego. Superego is that part of the personality that holds all our internalized moral standards, ideals that we acquired from both the parent and society that will make us to know what is right, what is wrong. Superego. The superego provides all the required guidelines in our mind, like Cochrane review of clinical recommendations. Similarly, in our mind also, there are guidelines for making judgments. So according to the Freud, the superego begins to emerge at around the age of 5. Now, multiple myeloma produce IgD, IgA, IgG, not IgM. IgG in 53%, IgA 25%, IgD in 1%. About the multiple sclerosis, there is a demyelination. Because of the demyelination that affects the spinal cord, the cerebellum, periventricular area, different clinical features appear. So you get ataxia, spasticity, which is the feature of pyramidal tract demyelination, and vertigo because the cerebellar demyelination. So weakness of multiple sclerosis of UMN type, it is usually accompanied with other pyramidal signs like spasticity, hyperreflexia, Babinski sign, etc., etc. Which drug is not used in candidiasis? We use itraconazole, voriconazole, fluconazole, not ketoconazole. And also we use echinocardins like caspofungin, micafungin, amphotericin B. So where do you see rot spots in infective endocarditis? Kusumal sign. At the time of inspiration, the jugular vein is supposed to collapse. But if there's a constrictive pathology in the heart, it is not ready to get filled from the jugular vein. So jugular vein remain prominent, which is called Kusumal. So Kusumal sign is a feature of any left side failure, right ventricular infarction, constrictive pericarditis. Any of them can lead to the development of Kusumal sign. So doctor, let us quickly take a 5 minutes break. Okay, go to the kitchen, prepare a hot cup of tea and join back after 5 minutes. Okay, 5 minutes. Also inform your friends that the session is there. Let them also join. So, welcome back to the NEET PG mock test discussion. I hope you're all back from a cup of tea. So, doctor, a 52-year-old woman with depression has a brain CT performed by the request of her psychiatrist. There is an incidental finding of a dense mass originating from the tentorium cerebelli. So, tentorium cerebelli is the common site of the origin for which kind of tumors? All meningiomas. Tentorium cerebelli is a fold of meninges, as all of you know. 65-year-old man with a history of atrial fibrillation, which is a common source of thromboembolic episode. Now, he presents with right-sided weakness, inability to speak, and he follows simple one-step commands. There is a left gaze deviation and impaired rightward gaze, flaccid paresis of the right arm and the face. Reflexes are decreased on the right side. So how do you want to evaluate? He has an acute cerebrovascular event. The most important test immediately would be a CT, mainly to know whether it's a hemorrhagic stroke or an ischemic stroke. Then if the patient has no evidence of hemorrhage on a plain CT immediately, if he is within that 3-hour time window, then you can give intravenous recombinant tissue plasminogen activator, which will improve the functional outcome after the stroke. 64-year-old man from Tirupati with a history of hypertension. Presents with vertigo, unsteadiness, hoarseness, dysphagia, ataxia, left facial plane, right side sensory loss. All this are pointing to what, doctor? Lateral medullary syndrome of Wellenberg. And always sensory loss of the tongue will be contralateral side. That's what you need to basically appreciate. So because there is a right-sided sensory loss, there should be a left-sided pathology. So that is the reason it is a left lateral medullary infarction is what you need to remember. 59-year-old dysphagia. Dysphagia is seen with the involvement of which nucleus? Nucleus ambiguous. Where is it located? Ventrolateral medulla. And it contains the motor neurons that contribute to the 9th and 10th nerves. 9th and 10th nerves is what you have to basically remember. Now, these neurons innervate the larynx and pharyngeal muscles and also provide preganglionic parasympathetic fibers to the thoracic organs. So any ambiguous, nucleus ambiguous involvement will lead to hoarseness and dysphagia. A 23-year-old woman doctor preparing for All India NEET PG describes a recurrent memory problem. Her fiancé reports that she is inattentive. Oh, very sad. There is a spike activity originating in the left temporal lobe when you have done EEG, so it is not generalized. When she was 3-year-old, she had febrile seizures. So what is the treatment for this? So first of all, what type of seizures they are? They are complex partial seizures. Complex yani consciousness gone, partial means focal seizures. For which the treatment of choice is carbamazepine is what you need to remember. A 63-year-old He has a 4-year history of progressive spastic paraparesis. Recently, he has incontinence, numbness in the right toes, pain in the thighs and back, and his neuroimaging has been shown to you. क्या है यहाँ? Aneurysm. So, he was referred for a surgical clipping of the aneurysm 3 months ago, which failed. What is the best next test? So this patient is developing gradually progressive myelopathy. One of the differential diagnoses is multiple sclerosis. That's the reason you need to do the MRI of the spinal cord. Now, what is that which lead to worsening of the multiple sclerosis symptoms? It is the hot weather, summer. So patient with demyelinating disease, the condition worsens with increased temperature. And this heat sensitivity is called Uthoff's phenomena, is what you need to basically remember. A 5-year-old boy with mental retardation, with homonymous hemianopsia, with hemiparesis, he has infantile spasms, has epilepsy, and calcification of the cerebral cortex in a railroad track pattern. So the question comes, railroad type of calcification, that is the clue to say it is Stooge-Weber syndrome is what you need to basically remember. Whereas craniopharyngiomas, acoustic schwannomas, they produce calcification, but they are all outside the cerebral cortex. Whereas in Stooge-Weber, it is the gyral pattern of the cerebral cortex called railroad track pattern is what need to be remembered. Now, an infant presents with cardiac failure, but weak femoral pulses compared to radial pulse, radiofemoral delay, characteristic of coarctation of aorta. High-risk newborns may, what is the cause of mortality, doctor? Birth asphyxia, low birth weight, prematurity. Diarrhea is a significant cause in under 5 mortality, not neonatal mortality. A non-immune fetal hydrops is caused by the parvovirus B19 twin transfusion syndrome. Whereas RH incompatibility क्या होता है? Immune fetal hydrops. That's the point. Total body radiation. Where do you do? Before the bone marrow transplantation, allogenic stem cell transplantation. So BMT patient is given aggressive chemo. On which day before transplant? Typically 10 days before transplant. Now, the most common malignant liver tumor in children होता है hepatoblastoma. And hepatocellular carcinoma is the most common malignant tumor in adolescents. Most common brain tumor in children होता है astrocytoma. And in children 1 to 10 years, infratentorial tumors predominate. After 10 years, supratentorial will predominate. Autosomal recessive cancer syndrome in children is typically ataxia telangiectasia. There is a mutation in ATM gene which is there on the chromosome 11 Q22 to Q23. And in ataxia telangiectasia, what do you have, doc? Progressive ataxia, recurrent sinopulmonary infections, ocular telangiectasia, and increased risk of lymphoreticular malignancies characterize the ataxia telangiectasia. And there is a decreased secretory IgA. Is what you need to remember. Yeah. Okay, chromosome level Q22-23. Please don't forget. Congenital adrenal hyperplasia. It is also recessive. Congenital rubella syndrome, narrow deafness is the common presentation. Single most common finding in congenital rubella. Wilms tumor, Beckwith syndrome, aniridia, hemihypertrophy, anything can be associated. Tinea versicolor. Both hypopigmented and hyperpigmented lesions will be there. Melasthesia furfur, orange fluorescence on good lamp, they're all true. But how do you treat tinea versicolor, doctor? 2.5% selenium sulfide. Systemically, you give ketoconazole, itraconazole, fluconazole, single oral dose. 55-year-old man presents with skin lesions on the finger, shown in the figure, sorry. He also has painful oral erosions. So, how are these, doctor? They are flaccid or are they tense? They are flaccid. So, flaccid bulle pemphigus vulgaris. It is a desmoglin 3 is a component of the desmosomes, not of hemidesmosomes. Antibody against that is what you typically come across. Once more, doctor. Sure short MCQ for the tomorrow's NEET PG exam hota hai. Pemphigus vulgaris versus bullous pemphigoid. Definitely puchega. Keratinocytes, Langerhans cells, dendritic cells, they are all involved in the immune system of the skin. Pustule, macule, nodule, they are all considered to be the primary lesions. Whereas lichenification, erosion, ulcer, excoriation, they are all secondary lesions. With regard to the hair, enagen, catagen. Once more. Sure short topic, doctor. Alopecia. Different types of alopecia. Scarring type, non-scarring type. Everything you should know. Alopecia areata. Where do you find exclamation marks? What are the list of etiological factors for the scarring type, non-scarring type, blah, 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 blah. Sure short aane wala topic hai. So, what is the effective way to become a NEET PG topper in the next 40 days? Simple way. Every day, doctor, there is one NEET PG full-scale grant test. So please download Incus learning app. Incus app. Morning, one test le lo. 100 MCQ ka of that day. Evening, 6 p.m, join the discussion actively. Identify 10-15 sure short topics बोल के मैं बोलते जाऊंगा. Then go back after the discussion is over to the 2000 HD videos on 953 topics, which is made available in the Incus app. Uska revision karo. Bas. Next 40 days, regularly, religiously, you follow Dr. Murali Bharadwaj, automatically seat आएगा. Enagen lasts around 3 years. Telogen lasts 3 months. Average daily growth कितना होता है? 0.4 mm without fertilizers. And there is a loss of around 100 scalp hairs daily is considered normal, whether married or not. Now, catagen is a transition or a regression phase. Usually, it lasts for about 3 weeks in duration. Is what you need to remember. AK surgery, we use propofol. Adrenaline to lidocaine ratio 1:200,000. Intracranial tension बढ़ गया तो ketamine is responsible. Ketamine increases everything. It increases intraocular pressure, blood pressure, intracranial tension, everything. Steroid synthesis ka suppression is caused by etomidate. Xenon, nitrous oxide, they do not undergo any metabolism in the human body. So, Doctor, that brings us to the end of today's full-scale grand test discussion every day 6 p.m. with Dr. Murali Bharadwaz. And next 40 days, garma garam, beautiful time is available for you. Ab maze se prepare hona. Another 37 days is there. Days does not matter, doctor. Quantity does not matter. Quality, quality, quality. Focus, focus, focus. 950 topics, high-yield topics. Each topic के ऊपर 15 points आपके मुट्ठी में रहेगा. And every day challenge yourself with a grand test on the Incus app and come down to the discussion in the evening. Good night and enjoy a great NEET PG preparation every day. Thank you.